1. Which organism ferments only glucose, is oxidase positive, and grows well in 5 to 10% CO2? 1. Neisseria gonorrhea. 2. Escherichia coli. 3. Shigella sani. 4. Klebsiella pneumonia. Answer: 1. Neisseria gonorrhea. It ferments glucose only, requires enriched media, and is oxidase positive. N2. What is the appropriate treatment for ophthalmia neonatorum caused by high N gonorrhea? 1. Oral penicillin. 2. Tetracycline ointment only. 3. Erythromycin eye drops. 4. Bacitracin cream. Answer: 3. Erythromycin eye drops. Creed's prophylaxis has shifted to erythromycin due to safety and resistance. N3. Which Neisseria species ferments both glucose and maltose? 1. Neisseria gonorrhoeae. 2. Neisseria meningitis. 3. Moraxella catarrhalis. 4. Neisseria lactamica. Answer: 2. Neisseria meningitis. It ferments both glucose and maltose. N. gonorrhea ferments only glucose. N4. Which of the following is used for selective isolation of Neisseria gonorrhoeae? 1. McConkey agar. 2. TCBS agar. 3. Thayer-Martin agar. 4. EMB agar. Answer: Thayer-Martin agar. King. It contains antibiotics to inhibit normal flora and isolate Neisseria species. N5. Which test is used for the diagnosis of typhoid fever? 1. Pfeiffer test. 2. Weedel test. 3. Schick test. 4. Mantoux test. Answer: 2. Weedel test. Weedel test detects antibodies against O and H antigens of Salmonella typhi. N6. Which organism produces Shiga-like toxin and can lead to hemolytic uremic syndrome? US. 1. Salmonella enterica. 2. Shigella flexneri. 3. Escherichia coli O157H7. 4. Yersinia enterocolitica. Answer: 3. Escherichia coli O157H7. It produces verotoxin, which can cause bloody diarrhea and HUS. N7. Which bacteria lacks motility, is acid-resistant, and requires a low infectious dose? 100 cells. 1. Vibrio cholerae. 2. Shigella dysenteriae. 3. Salmonella typhimurium. 4. Klebsiella pneumoniae. Answer: 2. Shigella dysenteriae. Highly acid-resistant and invasive, causes dysentery with a small inoculum. N8. Which organism causes enteric fever, rose spots, and is associated with a long incubation period? 1. Vibrio cholera. 2. Shigella sani. 3. Salmonella typhi. 4. Yersinia pestis. Salmonella typhi. Causes typhoid fever, a systemic illness with prolonged fever and rash. N9. Which E. coli strain causes traveler's diarrhea through heat label and heat stable toxins? 1. EPEC. 2. EIEC. 3. EHEC. 4. ETEC. Answer: 4. ETEC. ETEC produces LT and ST toxins leading to watery diarrhea. N10. Which gram-negative bacillus produces green pigment and commonly infects burn wounds? 1. Acinetobacter baumannii. 2. Pseudomonas aeruginosa. 3. Klebsiella pneumonia. 4. Salmonella enterica. Answer: 2. Pseudomonas aeruginosa. Produces pyocyanin and fluorescein pigments, thrives in moist environments. N11. What is the mechanism of Shigella toxin? 1. Inhibits EF2. 2. Disrupts actin cytoskeleton. 3. Inhibits 60S ribosomal subunit. 4. Activates adenylate cyclase. Answer: 3. Inhibits 60S ribosomal subunit. Shiga toxin blocks protein synthesis by inactivating the 60S subunit. Which characteristic is not associated with Salmonella typhi? 1. Produces H2S. 2. Motile with flagella. 3. Causes invasive systemic disease. 4. Lactose fermenter. Answer: 4. Lactose fermenter. Salmonella does not ferment lactose, distinguishes it from E. coli. Note N13. Which bacterium causes nosocomial infections and is highly resistant due to beta-lactamase? 1. E. coli. 2. Klebsiella pneumoniae. 3. Vibrio cholera. 4. Shigella sani. Answer: 2. Klebsiella pneumonia. Encapsulated and often resistant due to extended spectrum beta-lactamases, ESBLs. NN14. What is the classic vector for Yersinia pestis? 1. Mosquito. 2. Louse. 3. Flea. 4. Tick. Answer: flea. The rat flea transmits plague from rodents to humans. N15. Which bacteria is comma-shaped oxidase positive and causes profuse watery diarrhea. 1. Vibrio cholera. 2. Salmonella enteritis. 3. Escherichia coli. 4. Campylobacter jejuni. 1. Vibrio cholerae causes secretory diarrhea via cholera toxin, leading to severe dehydration. N16. Which organism grows best in high salt environments and is associated with seafood-borne illness? 1. E. coli. 2. Vibrio parahemolyticus. 3. Yersinia pestis. 4. Shigella flexneri. Answer: 2. Vibrio parahemolyticus. Halophilic, commonly found in undercooked shellfish. N17. Which of the following is true about Pseudomonas aeruginosa? 1. Ferments lactose. 2. Causes tuberculosis. 3. Produces piocyanin. 4. Inhibited by McConkey agar. Answer: 3. Produces piocyanin, blue-green pigment and grape-like odor characteristic of Pseudomonas. N18. Which gram-negative coccobacillus is part of Hayseck group and may cause endocarditis? 1. Vibrio cholerae. 2. Haemophilus influenzae. 3. Pseudomonas aeruginosa. 4. Salmonella typhi. Answer: 2. Haemophilus influenzae, a member of the Hayes group known for causing subacute endocarditis. N9 statement about Neisseria gonorrhoeae is correct. 1. Infects animals and humans equally. 2. Ferments both glucose and maltose. 3. Possesses pyeli adhesion to mucosal surfaces. 4. Frequently causes disease in newborns prenatally. Answer: 3. Possesses pyeli adhesion to mucosal surfaces. Pili are critical for attachment and antigenic variation. N20. Which test result helps differentiate E. coli from Enterobacter in IMVIC? 1. Both are positive for citrate. 2. E. coli is positive for methyl red. Enterobacter is negative. 3. Both are negative for indole. 4. E. coli is citrate positive. Enterobacter is citrate negative. Answer: 2. E. coli is positive for methyl red. Enterobacter is negative. Enterobacter? Let me know if you'd like. Tesh or N21. Which bacteria is most likely to cause meningococcemia with petechial rash and shock? 1. Haemophilus influenzae. 2. Neisseria meningitis. 3. Klebsiella pneumoniae. 4. Escherichia coli. Answer: 2. Neisseria meningitis. It invades the bloodstream, releasing endotoxins and causing DIC and rash. N22. What is the characteristic fermentative profile of Shigella species? 1. Lactose fermenter, gas-producing. 2. Non-lactose fermenter, H2S negative. 3. Indole positive, H2S positive. 4. Glucose non-fermenter. Answer: 2. Non-lactose fermenter, H2S negative. Shigella does not ferment lactose and does not produce H2S. N23. Which organism is associated with nosocomial pneumonia and current jelly sputum? 1. Acinetobacter baumannii. 2. Escherichia coli. 3. Klebsiella pneumoniae. 4. Yersinia pestis. Answer: 3. Klebsiella pneumoniae produces thick, bloody sputum due to heavy capsule and necrotizing inflammation. What is the primary virulence mechanism of Vibrio cholera? 1. Invasion of mucosa. 2. Shiga toxin-mediated protein synthesis inhibition. 3. Adenylate cyclase activation via cholera toxin. 4. Type 4 secretion system. Answer: 3. Adenylate cyclase activation via cholera toxin. Cholera toxin increases CAMP, causing chloride and water loss from cells. N25. Which of the following bacteria can grow on TCBS agar? 1. Shigella flexneri. Vibrio cholerae. 3. Salmonella typhi. 4. Pseudomonas aeruginosa. Answer: 2. Vibrio cholerae. Thiosulfate citrate bile salt sucrose TCBS agar is selective for Vibrios. N26. Which of the following causes plague and shows bipolar safety pin staining? 1. Klebsiella pneumonia. 2. Yersinia pestis. 3. Vibrio vulnificus. 4. Shigella sanae. Answer: 2. Yersinia pestis. Why? Pestis shows bipolar staining and causes bubonic and pneumonic plague. N27. Which of the following is a characteristic of EIEC, enteroinvasive E. coli? 1. Causes secretory diarrhea. 2. Forms Shiga-like toxin. 3. Invades mucosa and causes dysentery-like illness. 4. Produces heat label toxin. Answer E, invades mucosa and causes dysentery-like illness. EIEC mimics Shigella in its invasive pathogenesis. 28. Which organism is gram-negative, oxidase-negative, H2S producing, and motile? 1. Shigella dysenteria. 2. Salmonella enterica. 3. Vibrio cholera. 4. Neisseria gonorrhea. Answer 2. Salmonella enterica. It is motile, oxidase-negative, and produces hydrogen sulfide. N29. Which enteric organism is non-motile, encapsulated, and highly resistant due to ESBL? 1. Salmonella typhi. 2. Pseudomonas aeruginosa. 3. Klebsiella pneumonia. 4. E. coli O157H7. Answer 3. Klebsiella pneumoniae. It is encapsulated and often produces extended-spectrum beta-lactamases. N30. What is the function of the type 3 secretion system found in many enteric pathogens? 1. Antibody evasion. 2. Nutrient absorption. 3. Injection of toxins into host cells. 4. Capsule formation. Answer 3. Injection of toxins into host cells. This molecular syringe delivers virulence factors directly into host cells. N31. Which bacterium produces colicin, a type of bacteriocin? 1. Proteus vulgaris. 2. Pseudomonas aeruginosa. 3. Escherichia coli. 4. Shigella flexneri. Answer 3. Colicin helps E. coli compete with other bacteria in the gut. What is the diagnostic value of indole positivity in enteric bacteria? 1. Indicates capsule presence. 2. Indicates lactose fermentation. 3. Indicates tryptophanase activity. 4. Indicates motility. Answer 3. Indicates tryptophanase activity. Indole-positive organisms convert tryptophan to indole. N33. Which gram-negative organism requires high NaCl and causes sepsis in liver disease patients? 1. Vibrio vulnificus. 2. Salmonella typhi. 3. Shigella sane. 4. Klebsiella oxytoca. Answer 1. Vibrio vulnificus. It is halophilic and causes rapidly fatal septicemia, especially in cirrhotic patients. N34. Which of the following causes urinary tract infections? Ferments lactose and produces gas. 1. Neisseria meningitis. 2. Shigella flexneri. 3. Escherichia coli. 4. Yersinia pestis. Answer 3. Escherichia coli. E. coli is the most common cause of UTIs and ferments lactose with gas production. Which gram-negative rod causes greenish-blue pus in wounds and has a grape-like odor? 1. Proteus mirabilis. 2. Klebsiella pneumoniae. 3. Pseudomonas aeruginosa. 4. Salmonella enteritis. Answer 3. Pseudomonas aeruginosa. Known for its pigment pyocyanin and sweet, fruity odor. N36. Which organism is part of normal flora but can cause neonatal meningitis and sepsis? 1. Salmonella perithi. 2. Neisseria gonorrhoeae. 3. Escherichia coli. 4. Vibrio cholerae. Answer 3. Escherichia coli. E. coli K1 strain is a major cause of neonatal meningitis and septicemia. N37. Which of the following enteric bacteria produces urease and is known for swarming motility? 1. Proteus mirabilis. 2. Klebsiella pneumonia. 3. E. coli. Shigella dysenteria. Answer 1. Proteus mirabilis produces urease and shows swarming on agar plates. N38. What is the recommended treatment for severe cholera cases? 1. Ceftriaxone. 2. Tetracycline or doxycycline with rehydration. 3. Chloramphenicol only. 4. metronidazole. Answer 2. Tetracycline or doxycycline with rehydration. Antibiotics shorten disease duration. Rehydration is life-saving. N39. Which gram-negative coccobacillus was once a leading cause of pediatric meningitis before vaccination? 1. Haemophilus influenzae type B. Klebsiella pneumoniae. 3. Vibrio cholerae. 4. Yersinia pestis. Answer 1. Haemophilus influenzae type B. Hib vaccine has greatly reduced its incidence in children. N40. Which test is used to demonstrate bacteriolysis of Vibrio cholerae by immune serum? 1. Weedle test. 2. String test. 3. Pfeiffer phenomenon. 4. Schick test. Answer 3. Pfeiffer phenomenon describes bacteriolysis of V. cholerae in the presence of specific antiserum.